We had an increase in the provider portal adoption and Cite AutoAuth by about 80%. And our nursing staff increased their productivity double. Um, and part of the big thing for us was before we implemented Site AutoAuth, our providers were not using our provider portal. They did not like it. It was easier, right? Hit a button and the fax comes on over. And through all of the work that we've done with engaging our providers before we even went live, and Julie and her team has been working with providers one-on-one to educate them on how to use the portal and go through the criteria. Just seeing more providers use the portal alone was a big win for us. It was a really big win for us. And we had one big provider in particular that absolutely does not want to use the portal. And recently we've had, ongoing conversations with them about you can see yes, you have to go outside of your EHR and yes, you have to fill out some forms, but you can see right away if something is authorized and you can get your OR booked right away. You don't have to wait however long it's going to take for the review. And so they've just in the last several months started using it for the urgent requests. And the comment that they've made was, oh, yeah, this is so simple. It's very similar to what we've done with some other health plans. And we're looking very forward to that increasing.
Let's start with staff productivity. Our system was extremely manual prior to implementing MCG, like copy-paste manual of our policies, right? And so we were able to increase our productivity by over 80% by implementing policy customization and then the Cite AutoAuth.
We were completely taken aback and very excited. It was a really exciting moment to hear that our work was being recognized.
I was surprised because we were a small team and we came into it like, okay, well, we don't have project management internally, but MCG offered to, support us, of course. And we'd not worked with MCG before. So we were like, wow, okay, well, there's like 2 or 3 of us hanging out here that will be responsible for this project internally. And so we were a little nervous to begin with, but MCG was super supportive and things came together. We had a short time frame. We got the implementation done in 5 months. So we had a really quick turnaround in which to get this done. And so I was super surprised and grateful that we won the award. I think all things considered, we're, a medium, health plan. So we're not a huge health plan, right? And small to medium health plan. So, but we did an awful lot of work. There was an awful lot of blood, sweat, and tears that went into that from not only the few of us that coordinated and did a lot of the work for implementation, but the staff who had to be trained. And again, in that 5-month turnaround, who had to be trained and they're using it every day. And so when we brought it to the team to let them know we did the Doyle Award or we got the Doyle Award, we wanted it to be personal for them and how it applied to them. And so I think that was helpful. So then we got positive responses as well.
As soon as I saw that, I looked it up and I realized that that's a pretty cool thing. I've never been part of something like that before where, our work paid off in some sort of actual award. So that was exciting. I think we were all kind of surprised as well because we felt like since we're such a small team, it doesn't always feel as impactful. So just knowing that our little team that contributed to implementing MCG actually won something was pretty exciting.
I probably heard more from the executive leadership team than the staff on the ground, right? And they were very excited. They immediately were, wanting to share the news with the company and put out press releases and all of that kind of thing. And my boss, the chief medical officer, said to me, I don't know that you realize how big of an impact this is going to have on the company. And you need to be comfortable with sharing that news and taking that congratulations and accepting that the team did a lot of hard work and now is your moment to shine. We at Quartz Health Solutions, we approach the payer-provider relationship very collaboratively. We are in this together. We both want the same thing for our patients. And we both are, looking for resources. Everyone needs more help. So instead of being adversarial and saying, no, too bad, so sad, we come to the table on how can we help you? What can we take on? And what, are your pain points?